You're good.
We'll see. He seems like.
Shannon.
We have that on tape.
I think she went to go get her phone that was sitting over there.
I feel hands-free.
So I should put mine on silent.
Oh, you're good.
Good idea. Shannon. Good evening. It's just after 6 o'clock. I want to call this meeting to order. Shannon, can you do the roll call, please?
Dr. Moore. Dr. Robinette. Here. Dr. DeGuzman. Here. Ms. DeWitt. Here. Dr. Gullidge.
Here.
Mr. Adamson. Mr. Griffith.
Here. Okay, next item. We do have a quorum, so number 2, additions to and adoption of the agenda. Are there any additions? By voice vote, I'm,
So moved.
motion to adopt, thank you.
So moved.
Second?
Second.
Second, it's moved and second. Any additional discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Number 3, approval of the minutes. Are there any additional additions or modifications to the minutes? Hearing none, motion to adopt the minutes as presented. So moved. Second?
Second.
Moved and second. Any additional discussion? All those in favor say aye. Opposed?
Aye.
Aye.
Opposed, same sign. Motion carries. Okay. Number 4, we're at public comment, and we have visitors tonight.
They're agenda items.
These visitors are
Yes,
here
they're all
for
agenda.
new business. And do we want to go right to that business, or is there, should I say, is there any old business? No old business. Okay, so right to new business. The first item, A, is variance request, 1039 Willow Road, Zibby.
Thank you, Scott. So Ohio Administrative Code requires that a sewage treatment system maintain a minimum horizontal isolation distances. And in this situation, the property owner desires to build an addition to the rear of their existing structure that will be less than 10 feet from their septic tank. There should be attached documents so you can see the proposal. And so this property owner is requesting approval of their variance request to have the addition be less than 10 feet from their septic tank. I believe it's 5 feet.
So I put, sorry, excuse me,
Yeah.
I'm Steve and Garrick.
This property owner.
I put 5 feet, when I did it, but I was just eyeballing it, and then Megan come out with the,
Yep, a probe.
probe, and it's actually, with the 16-foot addition, be 7 foot. Okay, it's only 2 more foot, but it's still better than 5 feet. And one another addition too, that there, so it's not gonna be like a load bearing wall. The load bearing is gonna be on the east and west side, be the trusses, and that's just gonna be the front, and that's gonna be kind of like a Four Seasons room. So, but there will be a footer block.
Okay, Zibby, is there any discussion about this? I mean, we have the homeowners here.
So obviously our concern with it is with the construction possibility of damaging their septic tank with the moving of equipment, supplies, things like that. The property owner did sign the hold harmless agreement stating that he understands the potential for that and will not hold the health department liable for that if damage were to occur to a septic tank. But that would be our biggest concern with that. Not so much once it's installed, but the installation of it while they're driving equipment and materials through there.
Okay, is there any other information to present here on this? Okay, we have this resolution in front of us. I would like a motion for resolution approving or disapproving a household sewage treatment system rules variance at 1039 Willow Road.
So moved, approving the variance.
And a second.
Second.
Okay, we have a motion and a second for approving this resolution. Any additional discussion? Okay, can we take a roll call vote, please?
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Dr. Gullidge,
Yes.
Ms. DeWitt.
Yes.
Okay, motion carries. Thank you very much.
So I will invite you this time, unless you want to stay.
Thank you. Yeah, good night.
Thank you.
Okay, moving to number 6B, possible public health nuisance, Zuby.
All right. Looks like 9410 Milton Carlisle Road is our first one. This is a solid waste nuisance. The property is located in Bethel Township, right outside of New Carlisle. We have received numerous complaints on the property regarding the owners bringing in truckloads of trash and dumping it around the house. The county building and zoning department have also received multiple complaints regarding the property. We have not been able to obtain access to the property because property owners have a gate near the road, and the house sits off the road. We are able to see some stuff from the road. However, this is the aerial photograph. This is on our auditor's page, so you can see the concern. But then also the building department has a drone that they been able to fly from neighbors' properties to get some additional pictures that they were gracious enough to share with us. So you can just see, it appears that there's lots of trash bags flowing out of the garage, around the driveway, maybe coming out of the shed to the side, the picture on the right.
I have a couple others I'll share.
So the building department flew their drone twice, once in February, March, and then again Monday of this week. I have talked to the property owner twice and requested to set up a meeting on the property to allow me access closer to the house. However, he has not allowed me access to come back. The county zoning building department has also sent orders pertaining to illegal accessory structures, improper storage and parking of vehicles, trailers, boats, junk vehicles, and a suspected kennel operation at the property. So building department has, they're working with them as well, trying to get some of the zoning violations addressed. But tonight we're asking you to declare this property a public health nuisance.
Okay,
I'll offer just a couple of additional things. There have been complaints on this property since 2020. In my opinion, I think Zibby's opinion, it's overdue for action by the board. They really haven't shown any initiative to comply with our orders at all. And as you know, we give people plenty of opportunities. They've had 3 orders written, and first order was written back in March for this round of complaints. Again, multiple things all the way back to 2020. I'm not inspired at all by their actual inaction, that anything's going to change without some action from the board and potentially legal action by the prosecutor's office. This is pretty rough.
it's time.
Mr. Cook, what happens to the animals in the kennel? Do we know that there's live animals back there?
I have not seen animals when I've been to the property, but calls from neighbors have said there are. I know they have also expressed to me that they have called Humane Society, or what is it now? SPCA. They've had calls out to the sheriff's department for different things. The one neighbor I spoke to today stated that this weekend they were burning something, wasn't sure what it was, but it was really black smoke. But he's like, I don't, I couldn't tell what it was. There was just really black smoke coming from their property, which you don't normally get with what you're allowed to burn, clean, untreated wood.
There was, going back in the history in 2020, there were calls to the dog warden, there were calls to SPCA. There's no evidence in our files that they actually ever went out. A lot of times they need to be invited by us because we have the authority to investigate. If they're invited with us, they can come. So I don't know about animals at this point. I think you're right, Zippy, but just not to sound like broken record, I think we owe it to the community, the neighbors, to take some action here.
My main goal was to try and get access to the property, to get back there, to be more specific on, here are the things that we're concerned with and that we need. But the first time they said, we have busy schedules, we're not around often, let me get back with you. And I never got a call back. And then just yesterday, I spoke to them again and they said, we don't let people on our property because of our animals and we don't want anyone bringing diseases to our animals, so.
Someone lives in the property?
Yep.
Yeah.
Do we have the authority to do something about that? I mean, it doesn't look great, but, or like, do we have the authority to go in and tell somebody? I mean, how far away are they from the nearest house?
There's
Right there.
house in this
Okay.
direction here. The one on this side, is that east?
Yes.
The east is a little further out, but they're around there. Enough that people are calling and complaining. And it's been a variety of neighbors. I mean, if you look at the complaints, it's not the same
It's not,
person.
yeah.
But are we gonna be violating any of their rights as
Oh, no.
property owners?
We have, so there's two sections. So we've had these public health nuisances brought to us before, just if you're a background, there's two sets of laws that allow us to do it. There are state laws, and we have local laws, most recently passed in 2012, that allow for the governance and abatement of nuisances. This is the pure definition of nuisance if you look in both the state law and our local regs that we have.
What was the order, the first order, like I guess in March or whenever that they had ignored? What specifically did we order them to do?
Clean up the solid waste. In short terms. And then the second one is the exact same letter. It just says second notice. And then the third notice says, this is your final notice. And then we deliver a board order stating we're bringing it before the board. It cites the code section that they're violating as well.
Okay, I'll read this resolution and ask for a motion. A resolution declaring the property at 2760 South York Street, Springfield,
No,
No, no,
9410, sorry.
one above it. A resolution, pardon me, declaring the property at 9410 Milton Carlisle Road, New Carlisle, a public health nuisance under authority of Revised Code 3707.01, and further ordering the owner, Brandon and Catherine Dobbins, or occupants or heirs to abate the solid waste nuisance within 21 days, and if such orders are neglected or disregarded, directing the health commissioner or his designee to pursue legal action under Revised Code 3707.02.
So moved.
Second.
It's been moved and seconded. Any additional discussion?
Just one more question. Have they been invited to attend a meeting?
Yeah.
Okay,
Yes,
And you spoke to them
I
yesterday,
spoke to them yesterday.
okay.
and they knew it was tonight.
They did. He asked, do we have to come? And I said, if you want to
Right.
speak for yourself, absolutely come.
Okay.
All right, ask for a roll call, please.
Dr. Gulich,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith.
Yes. So that motion passes. Let's go to 6B2, 2760 York Street, Springfield.
Yes. This is also a solid waste nuisance. This property is located in the Limecrest subdivision of Springfield Township, just on the south side of Springfield. This property, there have been multiple mattresses, some other furniture like a couch, I believe, and some other solid waste scattered around the lot. And so we are asking you to declare this property a public health nuisance. Chris has got some pictures.
Which ones would you like me to show?
The most recent ones are at the very
Here.
end.
Most recent?
So I think that's from, the beginning of June.
This dates back to last summer.
Yes, I believe so. So couch. Looks like some wood pallets, cushions.
And is this a similar situation where you have talked to them and,
I have not, I've left message, but I have not, it's been a couple months ago that I attempted. And I believe has spoke to them.
That's the one I'm here for?
Yep.
I have proof that all that's gone.
Okay. Everything's fine.
You said you have proof, you have
Yeah,
pictures?
Yeah, on my phone.
Could we see them? Or want to see them?
Well, it's a
Sure.
video. Who am I showing?
You all want to-
You're all
Board
funny,
that-
dude.
anything up there or not?
Can we put them up there?
They're on my phone.
Probably not.
Probably not, easily.
Yeah.
The board's taking action, so the board should see them.
So you are the property owners?
Yes. Okay.
And Zibby, have you seen this yet?
I have not.
What's the date on this? Is that just, oh, today, okay.
All right, see a lot of stuff missing that was up here.
I mean, that's a grill in the car.
Right.
Other mattresses are gone out back, that's a flower bed.
So you've made, John, did you want to see that?
I saw it.
All right.
Say it again.
No.
So I would like for Zibby, sir, if you could show Zibby. And Chris, is that enough evidence for her to,
So what I would recommend to the board is if you decide not to declare it a public health nuisance, that you would ask for a follow-up from our staff within,
Okay.
well, Friday,
Yeah.
just to confirm.
Back where the mattresses were.
That's right over there. Perfect, thank you.
One thing, if I can say, about the lady that comes to the property, I understand she's allowed to walk on the property, but the windows are from 1940, single pane windows. There's two 80-pound dogs in there, and I told her, it's posted no trespassing, I understand you're allowed. There's beware dog signs. I have her on camera tapping on the window that the dog's barking at. I mean, she gets bit, that's her. I ain't putting my dogs down. If she wants to, it's one thing to do your job. It's one thing to fuck with my dogs. Sorry about my language. But single pane window, 80-pound dog, if they pounce on it, it's shattering. I've told her a million times. She only comes on the property when no one's there. She don't knock on the door when we're there. Today, when she came by, she just pulled out front, took a picture, and rolled out. It just, at this point, I understand there was stuff, but if you drive around Springfield, I got more videos, or it's on her phone actually, of just the street before mine and the street after mine. There's property spewing into the road. And she is literally, the lady that complains, she's dead, she's gone. You know what I mean? I understand that there's a mattress in the backyard. And she hates that I leave my trash cans out. That's where the trash cans are going to stay. So if you can tell her that I'm not putting them in the backyard so the dogs can get in them. You know what I mean? At this point, she only wants to talk to my kids and she wants to tap on my windows when no one's home, trying to get bit. That's not going to keep flying. Understand she's allowed on the property. She don't need to talk to anybody under 18, and she don't need to tap on my windows when no one's home, antagonizing my dogs, trying to get something further. That's all I want to say.
Okay, well, we have a resolution declaring the property a nuisance before us, but we've also seen evidence that we may want to not declare that tonight. Zibby, what would you like us to do?
I mean, I can absolutely, if you decide not to declare it, I will go out Friday, and verify that everything is cleaned up. And I can report back to you guys next month.
Sounds good.
I recommend tabling that, because otherwise you have to take action one way or the other.
So officially to table this, do I ask for a vote to table it, or?
Yeah, you ask. Yep.
Okay, I would ask for a motion to table item 6B2.
So moved.
Second.
Motion and seconded. Roll call, please.
Dr. DeGuzman,
Yes.
Dr. Gulich,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
So I'll also offer to the board, we'll let you know Friday. We won't make you
Okay.
wait till July.
So we'll hear back Friday. Okay.
Will I hear?
Yes. Is there a better time for me to stop out on Friday?
I mean, I don't know what time you get off.
After work, is that probably?
Well, she's home by 3:30.
Okay, I will just come out around 3:30, 4 o'clock.
That's fine.
Ball game.
Huh?
We got a ball game, so.
What time do you have to leave for it?
So 3:30 would be better.
3:30?
Yeah.
Okay.
Alrighty, thank you.
Thank you.
All right, thank you. Ziggy, thank you.
You're welcome.
Okay, move to, now we're at 6C, and we have contracts to review and approve.
The door does
Yeah, he didn't
Yeah,
slam
he
the
did
door.
say that. The door does
The
that.
door just, the closer doesn't.
Oh, thank you.
Especially when it's unlocked.
So Chris, we have interpreters with ESC.
So you have, in your electronic version, you've got three separate, it looks like three separate agreements, but it's all with the Educational Services Center. There's just different timeframes that those agreements apply to, and then total amounts. So this is nothing new. This is a continuation that we've had these agreements with the ESC for a number of years, actually dating back, I think, to 2020. So this just allows us to extend those agreements to pay them out of different funds through the September 30th of 26. That's when those agreements run out. So just look for your approval on those.
Okay, 6C, we have resolution authorizing the health commissioner to negotiate and execute a contract for interpreter services with Clark County Educational Service Center. Do you have a motion
So moved.
and a second?
Second.
Any additional discussion? With none, roll call, please.
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Dr. Gulich.
Yes.
Okay, that motion passes. 6C2, High Street Building Lease. Chris?
What you have printed in front of you, sheet that looks like this, got a little yellow highlighting at the very top. This is the tenets of an agreement with Community Health Foundation. They don't have an actual copy for me to look at yet. They take it to their board next week. So these are the basic tenets of that: to continue to occupy the High Street location for at least the next 5 years. You can see the term is a 5-year extension here with an option to renew for another 5 years. They put a small rider in there. It's going to be held at the same rent for 5 years, but then in 5 years, we elect to stay with them. It's a 3% increase in year 6. That would carry us through year 10, which is pretty nominal increase. The price per square foot at $5.24 is a bargain in any commercial building, frankly. A couple other things that we pay for inside this, again, this is continuing this lease agreement. We pay for a cost of utilities. We pay for a portion of their fire and casualty insurance that they carry. And then something new that we've incorporated into this, we've agreed that any repair replacement of the roof HVAC, and I got one more thing thrown in here actually today, is the sidewalks. I knew that'd make you happy, is a 50-50 split on these items. So that is the only thing that's really new in this agreement. But then it's, the previous one was 10 years, this is 5, with the option to increase another 5 years at the conclusion of this. Got a great working relationship with the Community Health Foundation. It's a good location for us. Like to be able to sign that for the next 5 years.
Okay, a resolution authorizing the health commissioner to negotiate and execute a lease agreement for the High Street building with the Community Health Foundation. Motion, please.
So moved.
Second.
Any additional discussion? Roll call, please.
Ms. DeWitt?
Yes.
Dr. DeGuzman?
Yes.
Mr. Griffith?
Yes.
Dr. Gullidge?
Yes.
Dr. Robinette?
Yes.
Next, we have manufactured home park inspections with the Ohio Department of Commerce. Zibby?
Thank you, Scott. So for many years, local health departments would license and inspect manufactured home parks. However, a few years ago, the licensing was moved over to the Ohio Department of Commerce, and they contracted with local health departments to complete the inspections if each local health department desired. So tonight, we're asking you to authorize the health commissioner to negotiate and execute a contract to complete the inspections of manufactured home parks in Clark County for the 2026 and 2027 years.
Okay, we have a resolution authorizing the health commissioner to negotiate and execute a contract to provide inspection services of manufactured home parks for the Ohio Department of Commerce for fiscal year 26 and fiscal year 27. Can we have a motion, please?
So moved.
In a second.
Second.
Any additional discussion? Roll call, please.
Dr. Gullidge?
Yes.
Dr. Robinette?
Yes.
Dr. DeGuzman?
Yes.
Mr. Griffith?
Yes.
Ms. DeWitt?
Yes.
Okay, next, that motion passes. Thank you. Next, smoke-free workplace, Ohio Department of Health. Ziggy?
Thank you, Scott. So in 2007, when Ohio passed the Smoke-Free Ohio Workplace, ODH, Ohio Department of Health, was given the responsibility of enforcing the law, and they contract with local health departments to investigate complaints if the local health department so chooses. So tonight, we're asking you to authorize the health commissioner to negotiate and execute a contract to complete investigations of complaints against the Smoke-Free Ohio Workplace law.
Okay, we have a resolution authorizing the health commissioner to negotiate and execute a contract for the smoke-free workplace program with the Ohio Department of Health. Motion, please.
So moved.
Second.
Second.
Any discussion? And roll call, please.
Mr. Griffith?
Yes.
Dr. Robinette?
Yes.
Dr. DeGuzman?
Yes.
Ms. DeWitt?
Yes.
Dr. Gullidge?
Yes.
Okay, that motion passes. Next, we have the dietitian, OPHA, Emily.
Thank you, Scott. As you may remember, at the beginning of the fiscal year, we received a registered dietitian to work in our Springfield office through OPHA, and this was to assist in serving participants due to our open health professional positions that have been difficult to fill and to provide certification visits in the hospital. The temporary funding for this contract is through ODH and will be ending June 30th. With positions still unfilled at this time and to continue offering certifications in the hospital, we would like to enter into the contract with OPHA for the next 3 months of the fiscal year. And I am requesting permission for our agency to do this.
Okay. We have a resolution authorizing health commissioner to negotiate and execute a contract with the Ohio Public Health Association for dietitian services for the WIC program. Can we have a motion, please?
So moved.
In a second.
Second.
Any discussion? And roll call, please.
Dr. DeGuzman?
Yes.
Ms. DeWitt?
Yes.
Mr. Griffith?
Yes.
Dr. Gullidge?
Yes.
Dr. Robinette?
Yes.
Motion carries. Okay. Next, we have a disease intervention specialist, Cheyenne.
Thank you. So this contract is not new, it's a continuation, and it's an annual one, and it's through Dayton, Montgomery County. And it's for disease intervention specialist Katie, who provides DIS service for Clark and Greene County. And that's just like STI management.
Okay. We have a resolution authorizing Health Commissioner to negotiate and execute a contract with Public Health Dayton, Montgomery County for disease intervention specialist services. We have a motion?
So moved.
Second.
And any additional discussion? Shannon, can we have a roll call, please?
Dr. Gulich,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
And that motion carries. Next, we have lead lice case management with Clark County DJFS. Cheyenne?
Yes, thank you. So this contract is through Job and Family Services. This is a 2-year contract, and it is also a continuation. It's not new. And this lets us test and case manage high lead levels in children ages 1 through 6 in Clark County.
Okay, resolution authorizing Health Commissioner to negotiate and execute a contract with the Clark County Department of Job and Family Services for lead and lice case management services. Motion, please.
So moved.
Second. Thank you. Any additional discussion? Shannon, roll call, please.
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Dr. Gulich.
Yes.
Motion carries. Okay. Next, we have out-of-state travel. Cheyenne?
Yes, we're actually really excited about this one. This is to request for 2 of our employees, Helena, who's one of our epidemiologists, and Nick, who works in communicable disease. They are wanting to attend NACHO's 360 conference in Anaheim. NACHO is the National Association of County and City Health Officials, and it's going to be July 14th through the 18th. But they both have scholarships, so it is $0. They got everything paid for, from food, airfare, hotel. The only thing that we would pay for is just their time there. So they are really excited for this one.
It's pretty cool.
Great.
Okay, resolution approving out-of-state travel for Nick Aldrich and Helena LeCaptain to attend the National Association of County and City Health Officials Conference in Anaheim.
So moved.
All right. Second,
Second.
any discussion? And a roll call, please.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Dr. Gulich.
Yes.
Motion carries. And it doesn't cost anything. It's pretty cool. Okay, next we have audiometer repair. Chris?
Thanks, Scott. Speaking of things, nothing new. This is something we typically bring to you every year. Once a year, we get our audiometer equipment calibrated, repaired as needed. They've estimated that cost at just under $1,700. However, I'm asking for a cost not to exceed $2,000. Because sometimes once they get into it, they discover there are things that when they don't pass, they have to fix. So hopefully that gives us enough headroom above what they estimated to do this without actually seeing the equipment to be able to pay for it. Worst case, if we have to ask for a little bit more, we'll do that next month. But that's what we're asking for tonight.
We have a resolution approving expenditure not to exceed $2,000 for the audiometer calibration and repairs. Motion, please.
So moved.
Second.
Any discussion? Roll call, please.
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Dr. Gulich.
Yes.
And motion carries. Next, we have driveway paving, Chris.
Wagner Paving just paved around County Garage, which is just, so you got our office, you got the recycling center, you got the County Garage, and then you get the home road. So they just did right around that. And when they were doing that, I was reminded of a conversation that happened a long time ago that said, hey, if we're ever paving in the area, if the county's paving the area, we'd have a discussion about doing the main entrance to our offices, which is a shared entrance to Project Woman, Recycling Center, County Garage, and us. And so started having a conversation with Jenny Hutchinson, the county administrator at the county commissioner's office, she was like, yep, let's do this. Let's move forward with this, this split. So what you see in your board packet is literally a 50% off coupon that I'm excited about. Not often do you get that when you go to pave something, but instead of the cost being about $23,000 to pave, again, I put a diagram in there. It's the main entrance all the way up to the turn to North Hyatt Place. Instead of $23,000, it's going to be half of that at just over $11,000. This is something. I mean, I don't want to. Don't get me wrong. I don't want to part with $11,000 like ever, but we're going to have to do this eventually. If you come in that way, you know that there's craters. They're not even holes anymore. We've done some cold patching in the last couple of years, and at some point that just doesn't even cut it. So this is an opportunity. The way that they would like to work this is that we will pay for it, and then they will reimburse us for half of it. So our out-the-door expenses are going to be half, and that's why it says $11,490 will be our final cost that we'll be paying ourselves, with the county paying the other half.
Chris, does that include the ceiling?
Yes, it's everything. It's mill. So they're going to mill down, and then they're going to put it just like they did. If you exit that way, you'll see what they did at the county garage. The same thing they did over there, and it only took them a couple of days. I think they were only here a couple of days at most. So I don't have a timeline, but as soon as we enter into this agreement, I know they wanted to do it. I mean, there's a finite amount of time that they can do this, in the good weather months. So.
Okay, resolution approving expenditure not to exceed $11,490 for driveway paving at the home road location. Motion, please.
So moved.
Second.
Second.
Any discussion? Shannon, roll call, please.
Ms. DeWitt,
Yes.
Dr. Gullidge,
Yes.
Mr. Griffith,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette.
Yes.
Motion carries. 6G, we have a hybrid worksite policy update. Chris?
Yeah, so this hybrid worksite policy had some very helpful input from some of our staff here, Gracie, Lori, who have been using a hybrid worksite, or more traditionally called remote working or work from home. They've been using that with their staff for frankly a number of years. And so this is truly just putting something into policy finally that we've been doing. And it's good because it lays across the entire agency. You'll notice when we wrote into this, it's a policy. We're letting individual teams and divisions develop procedures around that. So as long as they fit within the framework of this policy, individual teams can kind of delineate how they want their folks to operate when they're working off-site. A couple of good questions that I've had is this is going through our core team, our admin team, went to the board personnel committee, is how many people does this really affect? We've got about 20 people, I think is what we decided, that have taken advantage of this in various capacities. Not every person is able to use a policy like this. I don't know how you remotely give shots, right, Cheyenne? So, obviously not every position can benefit from this, but we do have some that it works well. Another question that I got is how many days a week? Is this 100% remote? No, we have nobody like that. This is 1 to 2 days a week for most of our folks. Sometimes it's a few more than that, especially with Lori's folks, but Lori's done a really good job of writing procedures for her team, and I know Gracie has done that as well. So we expect the same for some of our other folks that are going to be able to take advantage of this. But this lets us catch up, put things in writing that we've been kind of doing, and sets expectations for the entire agency.
All right, we have resolution approving the hybrid worksite policy as submitted June 18th. Do we have a motion?
So moved.
Second. Thank you. Any additional discussion? Shannon, roll call, please.
Ms. DeWitt,
Yes.
Dr. Gullidge,
Yes.
Mr. Griffith,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette.
Yes.
That motion carries. So 6H is staffing changes. Shannon.
Thank you. You can see here on a report, we have a couple positions posted, as Emily shared, mostly WIC. We have no resignations or retirements, and we had one new hire for early childhood, who Lori will introduce next month. That's all.
And so we have resolution appointing new employees to public health service as recommended by the health commissioner, hired from May 16th through June 18th. We have a motion.
So moved.
Second.
Second.
Any discussion? And roll call, please, Shannon.
Dr. Gullidge,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette.
Yes.
All right, motion carries. Okay, thank you very much. Next in 7 is financial reports, and let's see, 7A, expenses and vouchers. Jeff?
First off, hi. I've seen you all from over there the last couple of meetings, and truly an honor to be here. So, thank you.
You're welcome.
I want to talk to you a little bit about what's in the packet financially. But first, I know there's business to take care of. The first document you come across that it presents as 15 pages. Those are our expenses for the month. I'm happy to answer any questions, although I'm probably the least able on this side of the table to answer any questions that you have about any of those. The second piece financially is the transfers and advances, and we don't have any that were not budgeted this month. So let's talk about the bills,
Real quick,
if you have any.
we need to approve the.
He's asking if there's any questions about the bills.
We haven't, I'm not moving on.
Okay, sorry. Okay, go ahead.
No
If you
questions?
have any questions,
Thank you.
Sorry.
please feel free. Otherwise,
And do I have a resolution 7A approving payment of bills from May 1st and May 31st? Motion, please.
So moved.
Second.
Any discussion or questions? Shannon, roll call, please.
Ms. DeWitt,
Yes.
Dr. Gullidge,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman.
Yes.
Motion carries. So no transfers and advances, right?
that is
Jeff?
correct.
So-
Nothing unbudgeted.
Okay, so C is,
Monthly fund report.
yes.
Yes, sir. We give you 4 things, right? The first we just talked about. The second is the cash basis report, beginning balance, revenues, expenses, ending balance for all of our roughly 40 funds that are out there. And I'm probably covering ground you already know, but third one is monthly revenues and expenses. And then the last one, the extremely colorful one. I was here 2 months ago when Mr. Cook explained this and he did a fine job of it. That's kind of where we are versus where we were. The reason, and I'm sorry for taking so long to get here, the reason I'm sharing that, one of the things I'm trying to do, starting with the program heads, is just make sure, as much as possible, accurate, timely data. And I'm planning on asking them, not next week, but the week after, what my office can do to help them, or what they want to see that they're not currently getting. I'm trying to ask the same thing of you, right? So we're giving you 4 pieces every month. I just wanted to see, and it's not a please answer it now type question, but if there's something you come across that you're like, hey, I'd really like to see this, or this would be helpful in the board packet, please reach out.
Very good. Any comments or questions?
I'm just glad you're here.
Yes.
Well, thank you.
Me
So
too.
am
Well, thank you very much, Jeff. Okay, next we go to public health team reports, environmental, Zibby.
Thank you. So as we're moving into summer, we begin our season of festivals, farmers markets, and gearing up for the fair. The environmental health staff will stay very busy inspecting all the food vendors at all of these locations, and in order to help protect our community while they're enjoying festivities. My environmental health staff work hard and diligently with the food vendors to reduce that risk of illness for the people who are visiting them. And I'm just very appreciative of all the hard work that they put in, not just during this season, but all year long, and not just in the food program, but in all the work they do. So I just wanted to take a minute to say how much I appreciate them and the work they do. And then I just want to remind you that summer also brings the potential for mosquito and tick-borne diseases. So as you enjoy more time enjoying the pretty outdoors, remember to protect yourself with long sleeves, long pants, even though it is hot, and EPA-approved repellents. So that's all I have tonight. Any questions?
Trapping.
We are
program
not
this
trapping this year. We did not get the grant funding for mosquito surveillance. So we did not have the ability to do it without those grant funds. But we will still go out in response to any calls on mosquito complaints and help abate those with property owners.
Zibby, thank you very much.
You're welcome.
Nursing and clinic, Shane.
Yeah, thank you. Well, I was going to say, look at the packet, but I don't think the nursing packet got put in there, or unless I just skipped through it.
No, it's not in.
Yeah.
Well, in the
everything-
original.
So you're done.
So, goodbye. Well, we'll get that too.
Poor Cheyenne.
Honestly, I'm kind of, it's okay that
Our
it's not
fault,
on there.
Cheyenne, not
Because I was going to say next month it's going to look a little different because I have learned that Christina was kind of a guru and publisher and she could make that thing look real nice. My margins were terrible. It's like one chart would be this way, one chart would be that way. So next month it was going to look different anyways. But so clinic on the majority of the nursing clinics are higher than the last 3-year average. So we're still just seeing like a lot of people in there and the nurses are working really hard. We've had a few outreaches. We went to Grocery Land and we were partnered with AmeriHealth Caritas and they did blood pressure screenings. We also did a Heart Strong, blood pressure sodium education at USS. We went to that one. And then we went to, this was in Katy, our DIS, went to the Spring Fling at Hayward Middle School and did STI and HIV education there and had fun games and stuff. But that's okay, I'm done now.
We were trying for
We
you.
want to see your margins.
Yeah.
I actually had to fix them, so should I have? There was a good picture on there. of
Oh,
her.
okay, well, we can at least do that,
Yeah,
right?
just
That
skip
one right
to
there?
the- Yeah.
Oh, my goodness. All right, here.
There we go. That's not everybody, but
You wanted me to scroll to any of the pages of your data?
no, that's
I mean, we do want to check,
That's okay.
apparently we check your grammar and margins.
Pretty colors and everything, yeah.
Actually, that's very nice.
It's not as bad as you think it was.
This
Shannon, did you fix it for me? Yeah.
Just let it go.
All right, do you want me to go through it or do you?
No, that's okay. It just shows all the numbers of the clinics and all of that. So yeah, we're okay. But we'll make sure you get a copy of it.
Yeah, it was in your original.
It was.
It was in the
Yeah.
original, so I don't
Yes.
know what happened to
Yeah.
it.
Really don't know.
I think I'm just trying to get the new people. I'm trying to throw them off. I'm trying to throw Jeff off.
Jeff.
Cheyenne. Sorry.
She handled it well.
Good job, Cheyenne.
Thank you, sir. Thank you.
Early childhood, Lori.
Yes, thank you. I just wanted to talk a second about Help Me Grow funding. So, Help Me Grow funding used to be a block grant that Ohio Department of Health would send down to each county that has Help Me Grow, which all 88 counties do. And then about 10 years ago, Help Me Grow Home Visiting moved to a billable model. Help Me Grow Early Intervention Service Coordination through DD, Developmental Disability, stayed the same as a block grant. But Help Me Grow Home Visiting went to this billable. So it just means that we go do the service, do the visit, and then we put it all in and we bill for it, similar to like home health would. It's that way. And then about 13 years ago, we got an opportunity to apply for a maternal, infant, early childhood home visiting federal grant, which that acronym on my report, McV, has been there. So we've been able to successfully keep that grant for the last 13 years, and it was a block type grant. So this year it was $482,460. But the Department of Children and Youth has decided to take the federal money and then move it to the billable method. So starting July 1, all the services that we do for those families where we expanded is going to be billable. So it'll just be, it's a little bit harder on the home visitor, a little harder on the supervisor, administratively a little harder for me. It'll probably be a little harder for Jeff even, because those payments just kind of trickle in instead of like a block grant. So it'll just be an adjustment. We will definitely get there, but it will be a little challenging. So just to give you an update on that.
Okay. Lori, thank you.
Thank you.
Women, infants, and children, Emily.
Thank you, Scott. A couple updates to note. First, on the report, you may notice that the total caseload for Springfield and New Carlisle have been merged together and to Springfield only, and that's just for efficiency, staff efficiency when finding participants, while the closure of New Carlisle is still going on. And then this month does start the kickoff of the farmers market season. So we were able to attend the New Carlisle kickoff event on Saturday. Thanks to Amanda Cockburn. She was there providing program information to attendees. We did get some disappointing news. I think it was the end of last week, that the coupons that we receive for our farmers market benefits to give to participants are being slashed dramatically. Typically, we get 100 coupon booklets of $30 each to give to families. As of now, we're only getting 16. So it's a very severe cut. We're hoping we'll get a second round of coupons, but at this time we are not certain due to funding through the state. So hoping for positive and that we'll get some more booklets to share with our families, but just a little concerned about or disappointed that that's happening at this time. But that's all I have for the report.
I saw your booth at the farmer's market. Thank you for being there in New Carlisle.
Yes.
Thanks, Emily. All right. Health planning, Gracie.
Yes, thank you. So you have the packet in front of you. So much like Zibby mentioned, it is festival and fair and all of the season. So health planning doesn't go out and inspect, but they go out and do a lot of community outreach. So there's a lot of different events happening. I won't go into details about all of them, but two that I do want to mention. One is life sports camp that we have every year through our adolescent health program. Registration for that is open for any entering 5th through 8th graders. So that will happen the week or the month of July. So that's a full day, 5 days a week, full camp where they campers can learn sports, but also life skills throughout. They get a snack or breakfast, lunch, and a snack. So we partner with Springfield Promise to do that. So all of the information is on our website and social media if you know anybody that would like to attend. Additionally, I think I've mentioned this in previous meetings, but through the Creating Healthy Communities program, we are launching the first ever bike share program in partnership with the Clark County Public Library here in Clark County. So it has been Ashley who coordinates the Creating Healthy Communities program, has put in a lot of work on that, but it is officially launching on Monday. So we are very excited that there's a total of 7 bikes that can be we'll say rented or checked out by the library. There's also helmets and bike locks available and things like that. So we are very excited for this new program, and we hope that it gets taken advantage of by the people here in Clark County. So we're excited about that. And not to end on a bummer of a note, but I do want to mention, so we have gotten word through the Ohio State budget. Now, I know it's not final, but things are looking increasingly likely that the contract that we have for the Lead Safe Home is going to be no longer. That fund has been completely removed from both the House and the Senate versions of the budget. So this is what funded our education and awareness and workforce development. So not any of the case management or testing that Cheyenne was talking about earlier. This is on the prevention and education side.
So that contract currently goes through the end of June, and so we will have it through the end of June. It supports 1.5 full-time employee equivalents. So as of right now, we have enough wiggle room, very slim margins of wiggle room in other health planning grants that we can absorb that time. So at this point, there are no layoffs or anything. Just the program itself won't be as robust. So we don't know exactly what it'll look like. I mean, lead is still a concern and still a problem here in Clark County, so we don't want to abandon all education and awareness. So that will still happen. Unfortunately, we won't be able to put a lot of resources into like the contractor classes and, you know, partnering for abatement and things of that nature. So it is disappointing and a, you know, a blow to Clark County because lead is still a problem here. But those individuals that have worked on lead will get absorbed into other programs and get to learn about the different programs that we have through the health planning. So they're disappointed as well, but they're excited to learn something new. That's all I have.
Any questions? Gracie, thank you. And Chris, legislative update and comments?
I've been looking at the clock and I feel under the gun to finish by 7, but I've got like 4 minutes. I think I can do it. Hang with me. So before I get to legislative updates, I want to mention one of the programs that we have here that you've heard us say this acronym before is MAC. We have this MAC fund that we use dollars in that to do capital improvements or repairs to things that just don't normally sit in the budget. We don't have a capital improvement stream of income. And so we've used these dollars that we're able to get from the state effectively over the years. But the MAC, or Medicaid Administrative Claiming, is really a program that provides reimbursement to local health departments for our administrative activities that don't fall into a bucket that's like a billable service in a clinic. And so we have brought, over this last quarter, we have brought on, I don't know how many additional people we brought onto what was considered called MAC billing, people that can report their activities and things that are billable and reimbursable. So we have, did we double the pool of people? Pretty close, almost triple the pool of people that are doing this. And so, yeah, it's a little extra work because people have to track their activities for 1 week a quarter, a little bit differently and more involved than they normally do. Everybody has to track their activities normally in our system, but this is just one more layer for a week. 4 times a year, we ask them to do this. And so this resulted in some additional funding. So we almost doubled the amount of MAC money that we got in this last quarter, just because we did a little extra work up front. So in an era where we see funding cut, we've got to be more creative. And we sat down and said, we need to get more people on this. They're eligible. And yeah, it's a little bit extra work, but it's paying off. So just want to thank Shannon. She does a lot of that on the fiscal side of things. You see that on this side of the table too, but really just asking the staff to do this, that little extra work, trust me, it's paying off and I appreciate it. Legislatively, Gracie mentioned the one thing that's hurt a lot out of the state budget with the lead funding going away. A couple of things that are still floating around that we don't really know exactly how they're going to end up when you have 2 versions of the budget bill and you see it get squashed together and made one. Things can really change even to the last minute. We've seen some evidence that there's some Help Me Grow dollars that are going to be adjusted, but we don't have confirmation of that. So we're watching that very carefully from AOHC, Association of Ohio Health Commissioners standpoint. There's a couple other programs, including chronic disease. So there's a line item in the state budget for chronic disease. It incorporates a lot of things that are done by the state, but some of it gets passed to the locals. It was an $8 million line item that's being reduced down to $2 million, and 1.2 of that is being rerouted to a Parkinson's registry. So there's not much left in that chronic disease management fund at the state level. So those are some state changes. Then we look at the federal level. We got word just this week about our emergency preparedness grant being reduced. They think they're going to be able to return some of these dollars. So we're supposed to operate under the assumption that we're only going to get 72% of our emergency preparedness grant dollars from the feds pass through the state. but they've said they believe by October that they will find other ways to fund the other 28%. So we're very hopeful about that, but right now that's how we're operating. Is if we had 72%, that would last through March of next year. But again, very hopeful on getting that other 28%. If they didn't feel, and this is straight from the CDC, if they didn't feel like that was a possibility, I really don't think they would have said it. So I am hopeful on that. And then a couple of things that we've received, some interesting information about is other things being withheld. At the state level in June, they expected to receive federal pass-through notices of award in 10 different areas, 10 different grants. So far, they've gotten 0. So there's still a couple weeks left, and they're still hopeful, but it is very possible that 10 of these federal pass-through dollars to the state grants are not going to happen. I wish I had a list for you. I do not. We actually had a call today, and they did not offer that list. But the state is watching very carefully to see if we get these notices of awards or if things are just going to start disappearing. From a state legislature, let's go back to the state for a second. A couple of things that I just want to mention. One or two of these are repeats, but there's been some changes in them. House Bill 272 was a new introduction, so it has some language in there where it will remove things like additives, like food dyes and PFAS and a few other things, kind of mirroring some of the movement we were seeing at the federal level, at the state level. I don't know if it's going to go anywhere. It's only been introduced in the House. It hasn't even been assigned to a committee. It's very new. The one thing, though, is it was interesting inside this, it gives the permissive ability to add fluoride to water if a community so chooses, which stands in opposite direction of House Bill 182. If you remember, I told you about that last month, said, nope, you can't do it. So we got these two bills that have different language in it, and this is that. The House Bill 182 is in committee being studied. This one hasn't been assigned to committee yet. So we're carefully watching these, especially when you have two bills that are kind of opposed to each other. House Bill 289 is a companion bill to Senate Bill 78, which is the one I introduced, I think, 2 months ago that said we're establishing this Ohio healthcare plan for universal healthcare for Ohioans. This one doesn't have a lot of movement yet. They're in the Senate version is still in Senate committee. The House one, the new one that was introduced, this House Bill 289, is in House committee. So we don't really have a clear picture of where that's going to head, but there are companion bills now in both branches. House Bill 335 incorporates House Bill 309, 126, and 96. And you wonder why I can rattle those off very easily. It's because it scares me. This is the one that would eliminate property taxes in Ohio or change them drastically. There's there's 4 different bills floating around right now. We don't really know where it's going to land, but it could be very significant for locals, especially for those that have existing levies. Don't really know what that means for things that are on the books or what it means going forward. One of the most recent additions to this is in this House Bill 335, they are allowing local municipalities to increase sales tax by up to 1% to help offset that. So that is one addition that was made in this newest version of a House bill addressing property taxes. The other thing that is proposed in this one as well is that if there is some permissive language to do property taxes, but it would require a 60% passage rate in the municipality instead of what you would traditionally expect to be 50%, right? So it's, I almost hate to use the word interesting. It scares me. It really does, of where this is going to end up. On the list of things that Association of Ohio Health Commissioners is monitoring, this is at the number 1. This is at the top. And so, again, I don't know where it's going to head. I'll keep you apprised. I think a lot of us, including school districts who would be impacted, are really looking carefully at this. I think that's it for the House bills. I just want to say, regardless of what the landscape looks like at the state, the federal level, here on the local level, we're going to do the good work of public health as long as we can with what we have. Health is more than individual choices. Prevention is the best tool we have. And I think history is on my side with that. And I hope that history will show that going forward. Otherwise, I didn't make 7 o'clock, but I hope I provided you with some valuable information. That's it.
Thank you very much. And is there any additional business?
I have one thing, if we have one moment. I just want to take a moment to thank Dr. Gullich. This is Dr. Gullich's last board meeting. I know it's only been a little over a year that you've been serving with us, but I can tell you that What you brought to the table, literally and figuratively, has been invaluable. Your approach has been balanced, your perspective has been refreshing, and your questions have been thoughtful at every board meeting. And so on behalf of the community, I want to say thank you on behalf of our team, the board, and probably speaking for the board as well. Thank you for your service to this community, because that's what you do at these meetings. You are serving the community. Even though you're only sitting in front of a few of us, you are doing good work for the community. So I want to thank you. And you reiterated for me and underscored for me that having someone from academia is important on this board, something that we've never had before you. And so I just want to thank you for bringing that perspective to us.
We're still mad at him.
That's the fact. Still mad.
Thank you, John, and thank you, Chris. And our next meeting is set for July 17th. And with that, motion to adjourn the May 2025 meeting.
So moved.
Second,
Second.
moved in second. Any discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion is carried. Thank you. We are adjourned.